Welcome to DocTalk with your host, Brent Leavitt. And DocTalk with Brent is sponsored by Battleborn Financial.
Welcome to DocTalk. This is Brent Leavitt, owner and proprietor of Battleborn Financial Advisor and health insurance broker here in Pahrump, Nevada. We also service North Las Vegas and South Las Vegas as well. So this is being aired all over Southern Nevada, and we love to talk to you about doctors and primary care in the Southern Nevada area. We do a lot of stuff in Pahrump. We talk about all the Pahrump doctors. We've also had Vegas doctors in our meetings as well. I want to give you a little recap. This year, go back a little bit in time of all of our appointments and what we've talked about in the past episodes with all the doctors that we meet. Get to know them better. We've talked about how they look at primary care. I think we've hit a lot of topics and we repeat ourselves a lot in those topics. My goal in the show was to get people to know, hey, we have really good primary care doctors in the Southern Nevada area, and it's good to get to know them without actually visiting them in the offices. A lot of people are very timid when it comes to, I'm new to the area, or I don't like my doctor, I want to shop for somebody else, but you're just kind of nervous about even meeting somebody new. And I wanted to kind of let people know these other good doctors and get to know them on a virtual basis so you can see them and I can interview them and you get to know them better. I'm going to talk a little bit today. I know with Medicare season and health insurance open enrollment right now going on, it's people's minds and they want to know what plans and what options they have with their doctors. And I want to make sure you know that you can still keep your doctors and you have lots of options with regards to health insurance. This year is more confusing than ever with regards to health insurance, even Medicare stuff, because there are so many choices. We have plans available on the individual side with if you're on Nevada HealthLink. We have 5 choices this year, which is the most we've ever had. I mean, we've only had 2 or 3 in the last couple of years. So we're back to having 5 options this year, which is really awesome. And then on Medicare, if you live in Vegas, we have like 10 options with regards to health insurance companies. And in Pahrump, we have like 8 options. There's so many choices. And within those companies, those 10 and 8 companies, whatever, there's like 5 or 6 plans on each of them. It's like, how do you pick which one's right for you? I mean, it gets super confusing. And, you know, I've created in my mind myself, I get to know these plans. I read every single schedule of benefits every year, and I go through them all, look at all the rates, and I see what's going on. And trust me, like I even sometimes get confused on which plan's which a lot of times, and it's like, man, it's so difficult. But I always keep in my mind of what's best for the client and for you guys as you go in and you try to find your plans. Like, how do you find that right program for you? I get to know which doctors take which plans, and how to coordinate that, and which medications they take. We always have really cool tools that tell you how they cover the medications. And it's important to know those. So we're going to talk a little about, I want to go back in time a little bit as we go through here. And I'm going to go through the doctors we've talked to, and also doctors we haven't even got to meet yet, and talk about the plans they take. So the first episode we ever did was with Dr. Marianne Hazlett. If you remember her, she's a great primary care doctor in Pahrump, Nevada. She's actually has an office off of the 160 and near the Homestead area off by the 3-story bake building. And she's a really good primary care doctor. She works with a lot of the, she's actually takes a lot of different plans. So if you're under 65, she works with Select Health, she works with Health Plan of Nevada, and she also works with Anthem Pathway. On the Medicare side, she takes 3 plans on Medicare too. If you're on Medicare plan, she takes Select Health, she takes Humana, and she also takes United Healthcare, which is new to this year. If you looked at other episodes, we talked about Intermountain Healthcare and how they're changing plans and they're out letting people see them on different plans. Dr. Hazlett's actually an affiliate with Intermountain, and she works with them a lot. We really enjoy working with her because she's kind of an all-around doctor. We get to meet her and know all the different plans she takes. So there's so many choices with her. Unfortunately, you know, there's a couple plans she doesn't take, and we got to make sure to know which plan she takes there. We also know next door to Dr. Hazlett's office is actually Renee Goodhart. She's a nurse practitioner. We met with her a little bit this year. And Renee Goodhart, she's actually affiliated with the P3 network. She's an affiliate with P3. And so she takes about 4 different plans with her on the Medicare side. She takes Aetna, and she also takes Anthem, which is new to the Pahrump this year, Anthem Blue Cross Blue Shield. She also takes Allwell, the P3 plan with Allwell, and then she's also contracted with Senior Care Plus, who uses that P3 network. On the under 65 stuff, she also takes Ambetter, and then she also takes Health Plan of Nevada. And she's a great resource, and we love her because she's a great nurse practitioner. and she helps deal with those needs and stuff if you can't really see. She helps you get in to see the doctors and things like that and understand your chronic conditions, and she's a great nurse practitioner. She's been here forever here in Pahrump. She's long-standing history there. We also have, going back, we met with Dr. Eric a lot of times. He's a Pahrump cardiologist, and he actually opened a primary care office here in Pahrump because he found the need of, hey, I'm going to offer my services as a cardiologist, and he's invested so much money in our town with regards to getting cardiology needs here and making sure you have state-of-the-art programs. You make sure your heart health is healthy. He hired on a couple different nurse practitioners. We have Melanie Lentz, who's actually joined his practice recently, and Melanie is actually she's working in the Calvada office, working with primary care and getting people their chronic conditions and things like that. And they have joined up on the Medicare side with the P3 medical group as well, just like Renee Goodhart. And any of the P3 plans, she can actually be your primary care with. And the cool thing is also Dr. Eric is also contracted with the P3 program as a specialist. Dr. Eric as a specialist, he also works heavily with Humana. He's been with Humana for a long time because he was an affiliate with Intermountain Healthcare and on the Humana HMO Gold plans, and he's also takes Humana PPOs. Very good. They focus a lot on the senior populations with their office. So we have Melanie Lentz and then Dr. Eric as well, which is great on that program. We've also met with Spring Mountain Medical in this group. We got to meet with a few different doctors and things like that with Spring Mountain Medical. And a lot of people know them for their chiropractic care. Dr. Taylor and Dr. Griffith, they work with us a lot. And we've also had some nurse practitioners that have come out here. And they do the whole holistic physical medicine. And Spring Mountain Medical also partners with P3, the medical group. And they work with those 4 different plans I mentioned with Renee Goodhart, where they do we have Allwell, we have Aetna, we have Anthem, and then with Senior Care Plus that they take. So they're very good to work with them. They also work with a lot of individual insurances, such as Ambetter and Health Plan Nevada, and other programs as well. So Spring Mountain Medical has been a great resource here in Pahrump. In fact, I got an email this morning about one of their patients, and she's like, Danny Griffith fixed my back and made life so much better for me. I always think of just that as how great those people are, especially for chiropractic care here in town. And Spring Mountain Medical even has a lot of specialists that come out from Vegas at their office. And so you can see them actually at their office for specialty care a couple times a week that they're out there. We've also met with P3 Medical Group, Dr. Harding and also Chaudhry Bonds. We get 2 interviews with them. And they are P3. I mean, that is the P3 group. And they work with all those 4 different carriers I mentioned too, like Aetna, Humana, Humana, Aetna, Allwell. They take Anthem and also Senior Care Plus, and they work heavily with them. We have a few people that were on Select Health this last year. Unfortunately, Select Health is not working with P3 anymore, but they're going to be going to Intermountain Healthcare Network in their plan network this next year. So unfortunately, if you see Dr. Harding and you're on Select Health, you need to switch you need to change your plan to another program if you want to keep Dr. Harding or Chaudhry Bonds as well. And then we also met with Partners in Primary Care. They're a great new group that's coming to Las Vegas. They work a lot with Humana. They're a great program, and Humana is actually changing some of their programs with regards to their doctors. So if you're on Humana, you can switch to Partners in Primary Care doctor in Vegas, but their specialist network actually is a little bit different than they had before. We also met with Intermountain Healthcare. We've met with Dr. Wilson over there, and we have a few doctors at Intermountain Healthcare. I think Intermountain Healthcare is changing a lot of the way they do things. It's going to become an even better facility. A lot of the plans that they work with, they're still working with Humana, they're working with United Healthcare, and they're working with Select Health this year. And they take a lot of the under 65 products too. We met with some of their other, we have Dr. Rebecca O'Rourke over there, and that also take the patients that are not on Medicare yet. And they work with Health Plan Nevada, they work with Friday Health Plans, and they also work with Health Plan Nevada, Friday Health Plans, and then they also work with all the Medicare products as well. I'm going to talk a little, I will say something about them, and Intermountain Healthcare is actually owns another insurance called Select Health, and I mentioned them a little bit earlier here too. Select Health is offering individual plans and Medicare plans, and they're only working with Intermountain Healthcare, and it's been a great program. And a lot of people don't know this, but all those plans, because Intermountain Healthcare came out of Utah, and they actually have primary care doctors all over Utah. And we've had a lot of patients that are like, hey, I go back and forth from Utah to Nevada, and those Select Health plans actually allow you to see doctors in both Nevada and Utah. It's kind of been a unique thing with regards to they allow that network access. They all speak together, their systems all do, between Utah and Nevada. And Intermountain Healthcare has actually been rated one of the top 3 medical groups in the country. They do a lot of great things, and they've integrated medical care. And we're kind of blessed to have them in Pahrump and also Vegas, and they help try to make sure healthcare is really good. Also on our show, we haven't been able to interview yet, but we also have here in Pahrump, we also have Southwest Medical Associates. We have Dr. Wong, and they have a few different PAs that have come over there and that work with us. Dr. Wong's been in Pahrump for quite a long time. A lot of people get to know him and work with him. And Dr. Wong and Health Plan and Southwest Medical, they work closely with like Health Plan in Nevada. They also take Anthem, the Anthem Blue Cross Blue Shield plans on Medicare, and they also work with, besides Anthem, they also work with all the United Healthcare products. And their network of Southwest Medical, they've been in Southern Nevada for such a long time. I mean, as a kid growing up, we always had to go to Southwest Medical because all my parents always had like Health Plan Nevada plans and health insurance. And they work with you closely over there to make sure you get the referrals and things like that really quickly. And appointment times for me have always been pretty quick at Southwest Medical. If you can go online to smalv.com and you can actually register appointments online even. They try to keep those records great. I also have not been able to meet with Dr. Reiner's office, who's a lot of people know him at Independent Medical Group. And Dr. Reiner, we're hoping to get him on the show soon. But Dr. Reiner's he practiced medicine, and a lot of people really enjoy him because he's been here so long. In fact, one of the ladies in my office, she remembers as a kid growing up and how he saved her life and made a big difference in some medical discoveries he found with her and helping take care of those conditions. So a lot of people know him and like him a lot. And he's been, I think, all the Pahrump programs that all the little voting of the best of Pahrump, he's actually been voted one of the best of Pahrump for primary care, which is a good thing for him. He works a lot with United Healthcare on their HMO plans on Medicare. And then if you're not on Medicare, he works with Health Plan Nevada, he works with Anthem, he works with Ambetter. He works a bunch of different plans, and he's very, very well versed in those programs and takes a lot of different insurance plans. We're talking about later on the next section, we're going to talk about prescriptions and coverage with that. Hope I didn't confuse you too much, but I kind of did a little bit of a revamp of all the doctors we work with. And like how we get to know better, if you come into our office and say, Brent, hey, Arbiana, whoever you're working with, I have a question about this doctor, I really want to keep them. How do I get good primary care and make sure I get the right insurance to match them? And it's important we do that. And that's kind of things we talk about. And hopefully you enjoyed the little background with it. And we'll talk about some prescription coverage and things like that in the next episode. Thanks so much.
Welcome to Doc Talk with your host, Brent Leavitt. And Doc Talk with Brent is sponsored by Battleborn Financial.
Welcome back to the Talking Head Show. No, this is Doc Talk with Brent Leavitt, Battleborn Financial Advisor. We're talking about healthcare and primary care. We've been kind of doing a little bit of a backdating into our prescription coverage, or back to our last episodes talking about doctors and all the interviews we've had and the plans that they take, and kind of reminiscing about all the different programs we have here with, how great Dr. Harding and Dr. Craig, Intermountain Healthcare, all these different great doctors that we work with here in this town. If I missed somebody, I do apologize. We're trying to get everybody's names and try to go back and review all the episodes we've had. I wanted to spend this section of the episode talking about prescription coverage, which is the second most important thing when it comes to getting a health insurance policy. And during open enrollment, it's kind of a big deal to get the right plan for you because we get to make decisions for the whole rest of the year. And if you want to make sure you're saving the amount of money, getting the right programs, it's important to know what's coming with prescriptions. So I'm going to give the first section of this episode, we're going to talk about Medicare and prescriptions, and we'll spend the second half talking about non-Medicare stuff and prescriptions and how that works. Because not everybody that watches our show is on Medicare. They're all on different programs or, I got all walks of life that we work with. And so it's important to know and understand how prescription coverage works with health insurance, because that's a big confusing thing for all of us. And if you have more questions or I don't explain it well on the show, call my office, 775-764-2252. Make an appointment with us, and we'll sit down and I'll actually explain it a little bit more in depth with you and talk about your specific needs. And you'll also go on our website, battlebornins.com, where you can schedule an appointment on the website, and we can get you in the office, either in office, in person, over the phone. We can do telemedicine type virtual appointment if you want to as well. So, regards to Medicare and prescription drug coverage, the way Medicare works on prescription coverages is when you have Medicare Part A and Part B, you have to get a prescription plan, and you can get it one of two ways. You can get a prescription plan either standalone by itself, or you can have it included in your Medicare Advantage plan. And if you get it standalone by itself, you'll pay an insurance company like a Humana or United Healthcare or somebody else to have that prescription-only coverage, and your medical insurance will still stay with that original Medicare program. If you stand it standalone by itself, that prescription coverage will take care of just your medications. If you enroll on a Medicare Advantage program, which kind of encompasses Part A, B, and D, all into one package, all your prescriptions are handled by that Medicare Advantage company. Some people ask the question, well, can I get a drug plan? Can I get one Medicare Advantage plan and somebody else's drug plan? No, unfortunately, you can't do that. You have to, if you get a Medicare Advantage plan, you cannot get a standalone drug plan. It's kind of all built into one package. And that's kind of why we have that open enrollment period every year between October 15th and December 7th, where we can enroll in a Medicare drug plan or Medicare Advantage plan for the new year. We're allowed to make changes. We're allowed to say, hey, what's new for the new year? Let's get it and enroll. And they let you pick and choose. And if you pick a Medicare Advantage plan, it kicks out the drug plan or Medicare Advantage plan that was there before, because you can't really double dip. It lets you just pick one. Prescription coverage on Medicare is really important because your medications can, as you get a little older and your bodies just naturally change, we tend to need some medication to make our lives a little bit better. We get things, things don't work like they used to. Maybe we come down with diabetes, or maybe we have heart conditions. We just need to make sure we keep our heart blood pressure low. The cool thing about modern medicine is we're living longer and healthier than ever because we have all these modern technologies to make our lives better. Just because we put a lot of hours on our bodies and time, and just got to make them better and run better, more efficiently over time. And when you get your medications, we'll find that a lot of the Medicare Advantage plans typically have a leg up when it comes to your prescription coverage. And you're wondering, well, why is that versus the standalone drug plans? Well, it's because Medicare Advantage plans get extra funding from the government to not only manage the drugs, but also the medical side of things. And you'll find that there are special needs plans on the Medicare Advantage plans. There are HMOs usually that get even more funding to help fund people's chronic conditions. The federal government wants to make sure that these people are taken care of and they have better health outcomes. And if you have a chronic condition, maybe diabetes, or maybe you have a heart condition or lung, you have a lot of inhalers and stuff like that, it's good to look at those special needs plans because they get extra funding to make sure that your medications are affordable. Because the most difficult thing we talk about on the show is people not taking those medications, and those chronic conditions become worse and worse and worse, and they make your health a lot worse. I mean, I think of every day every time the seasons change here in Southern Nevada, we get wind that blows like crazy, and allergies just go crazy. And I imagine, not taking your inhalers or having those things for your body, it's going to be more difficult for you to be able to breathe, and it causes other conditions. You get stuff in your lungs, and you get bronchitis, and you're just sicker and sicker, and you end up in the hospital, which we don't want to happen to you. So it's important to have your medications, and you can afford them. And so those special needs plans make a big difference for you, especially if you take any inhalers or even like insulins. Insulins can get really expensive. The good news is in 2021, we have some new legislation that came out, and a lot of these plans are actually participating in a program where they actually make insulins even cheaper. You don't even have to worry about donut holes on a lot of your insulins. It's important you look at those plans. We actually have plans that are not even special needs, and they cover those insulins even better. You don't have to have a special needs plan. We got like Senior Care Plus and United Healthcare, and also Anthem, that are participating in those programs where they're making insulins like really affordable, less than like $30 a month for those insulins. I know a lot of people are complaining about, man, why are insulins so expensive? They shouldn't be paying so much for them. That is a great complaint, and the cool thing is they've addressed those, and the insurance companies are working with the governments and stuff to make that happen. If you get a standalone drug plan, unfortunately, you have to make sure we shop those around and get to the right one that meets your needs. And they'll still cover the insulins, but you'll find that a lot of the standalone drug plans will have a little bit higher deductibles on them, so you got to be careful which one you pick, and make sure your meds are covered correctly. We're kind of at the second half of this first episode. I mentioned we're going to talk about under 65 prescriptions. And they're very similar to Medicare stuff too. I'm going to go back and talk about Medicare as well with donut holes and things like that, explain how those work. But I want to talk about formularies and tiers. So both Medicare and under 65 plans, they make medications into these tiered systems. So we call them a formulary. And they'll have a tier 1, a tier 2, a tier 3, and tier 4, and like tier 5. So on both Medicare and non-Medicare stuff, They have these things called formularies. They put medication under these tiers. So what you'll find is every insurance company, they work with their medical directors, and they look at what common medications people are prescribing for certain conditions. So let's say, for instance, they take diabetes, for example. They look at diabetes and what medications treat diabetics the best. And they'll have a whole bunch of medications. A lot of your generics will be under tier 1 or tier 2s. And those are your preferred or non-preferred generic medications a lot of times. And they'll put those under those tiers because they're commonly used and they're not expensive to work with. And so the insurance companies will make those the cheapest tier for you to be able to get medicated. Tier 2 or 3 medications will be your preferred name brand medications. And those will fall under higher copays. On Medicare, usually those are $47 copays. On regular health insurance, they can be ranged anywhere between $40 and $100 copays for those medications. And those preferred name brands are usually going to be a lot of your medications where they don't have a generic yet for them. Sometimes on the Medicare side, we'll have some carriers that will put preferred name brand status on a generic, even because there's alternatives for it that they'd rather you be on, or it's an expensive medication. But you'll find that those, make sure if you're on a name brand medication, just know that it could be a lot more expensive. Insurance companies still want you to take those if they're important and they work for you, but they're not going to give you as preferred a status because it's costing them a whole lot more. A lot of these preferred medications are $400 or $500 medications, and they're only charging you $47 for them. That makes a big difference. Tier 4, 5, and 6 medications, all those larger tiered medications fall under those specialty tiers or non-preferred medications. So that means if you have a certain condition, if you're on a medication that's a tier 4 or up, that usually means there's alternatives out there that cover that condition. Now for you, that might not be the case. Maybe you have to be on that specific medication, and that's why you're taking it. And you can't take those other preferred medications. But insurance companies look at just the group as a whole and say, well, typically these medications cover those conditions. They're tier 1, 2, they're preferred name brands, non-preferred name brands, and they cover those medications. But the alternatives, those non-preferred name brands or those specialty medications, they treat the conditions. They might be newer. They're ones you usually see on TV. The medications that they haven't been established by the medical community yet. And unfortunately, they're really, really expensive. And so your cost sharing or what you pay for them is going to be higher on those plans. On under 65 plans, your out-of-pocket maximums that you have on your health insurance will actually include prescription coverage. So a lot of people are really happy with the fact that if I get a plan that say has a bronze plan or a silver plan, whatever plan you're getting, and you fill a lot of expensive medications, you will not have to worry about them reaching a certain dollar amount for all your medical care throughout the year, including prescription coverage. So you may be worried about, hey, I'm capped at $80,000, and the standard rate this year is $8,550 is the max out of pocket for individual plans. You're not going to exceed $8,850 or $550 out of pocket for all your medical expenses, including prescriptions, and that makes things a lot easier for you. But Medicare is a little bit weird, and if you're on prescription coverage under Medicare, they look at what you're paying for the medication, and you're going to go through these different phases. So the first phase, some plans have a deductible phase, and you'll pay like the full price of medication until you reach that deductible. A lot of your standalone drug plans will have that, and it's $445 usually. And then once that deductible is met, then you'll fall into this initial coverage phase. And during that initial coverage phase, you'll pay that set copay like I've discussed earlier, that $2, $8, or $47 copay for that prescription. Once you've reached around $4,000 of medication cost for the year, you'll fall into this thing called the coverage gap, also known as the donut hole. And instead of paying that small copay for that medication, you'll be required to pay a percentage of that medication. It's usually 25% during that last phase. And then once you reach a certain max out of pocket or a catastrophic amount out of your pocket, then the insurance then you'll have to pay 5% of your medication the rest of the year. So a lot of people on Medicare, that's a big concern because it's like, I could be paying thousands and thousands of dollars for medications. That's why it's important to understand some of the plans that have special needs status because they actually cover those medications in the coverage gap or in the donut hole. I mentioned earlier a lot about diabetic stuff earlier is insulins. These new plans that I mentioned, they actually cover insulins at the regular $30 copay, even if the medication would normally cost thousands of dollars in that donut hole. So they make a big difference on your costs. Again, it's one important of medications and formularies and all this stuff. It's important to understand what medications you're on, how they cover them. A lot of people also wonder about, well, what if I don't know what medication I'm going to take for next year? Something happen to me. Well, the good news is all these plans have these formularies. They've designed programs to meet your needs and still will cover the medications you need. But they're going to go through steps. You're going to go through step therapy a lot of times where, hey, I just got diagnosed with diabetes, what I'm going to get on. Well, they're going to give you usually the tier 1 medications first to find out if that works. And then if that doesn't work, they'll give you the tier 2 medications. Or if that doesn't work, the tier 3 medications. They're going to go through that list to try to get you the care you need to make sure you're up to speed. And it's important to work with your primary care doctor because they understand you and your medications and how to work with you. And then you work with your insurance broker like us, Battleborn Financial, and you say, hey, what medications am I on? What plan meets my needs best? And how do I get my doctor and keep them going? Tune in next week. We're going to be meeting with more doctors and dealing with them, and love to see you soon. Thanks so much for